Welcome, welcome everyone to our last session. What stands between you and the leaderboard is us. My name is Bijia Jackson, and I'm the Director of Healthcare at Genentech. It gives me great pleasure to introduce the next panel, anchored by Gerren Wilson, PharmD, Lifecycle Leader at Genentech. The panel members are Meghan McKenzie. She's an internal partner in the Chief Diversity Office, and Rebecca Monroe, the Policy and Governance Lead. The title of today's talk, The Bottom Line. Let's bottom line it. A panel discussion on non-traditional healthcare costs and emerging access solutions that may save patients money. The treatment of chronic illnesses commonly includes the long-term use of pharmacotherapy. We all know that just simply means treatment by means of medicine. Although medications are effective in combating disease, we know that their full benefits aren't often realized because approximately 50% of patients don't take their medications as prescribed. We know some of this is due to cost, but there are many financial barriers to health equity. The panel today will talk about solutions to healthcare costs that may save patients money, may save you money on this virtual call. So please join me in welcoming the Bottom Line panel. Over to you, Gerren.
Well, thank you, Vijia, and good day, everyone, wherever you happen to be tuning into this meeting, this summit. Thank you for making this a part of your day. We are really excited to help bring today's summit to a close with a really important topic. As Vijia alluded to, there are financial barriers that can oftentimes prevent patients from receiving their best care and ultimately putting you on a path towards a positive outcome when you're faced with some serious illness or chronic disease. And that's really what we want to dig into this afternoon. Over the next 25 minutes, we'll leave some time at the end of this presentation and the panel discussion to invite some questions from all of you in the audience. So feel free to fill up the chat box. Let us know what's on your mind, and we will dig into some of those questions as we get to the end of our discussion today. But maybe a brief grounder before I turn it over to Rebecca and Meg to give us a bit of an introduction to them, their expertise in this area, and then we'll dive into the discussion. As an organization, Genentech really prides ourselves on doing now what patients need next. And our current vision, what's animating a lot of work across the organization, is to provide more patient benefit at less cost to society. Now, I'm going to repeat that: more patient benefit at less cost to society. Now, I'll break that apart, and then we'll start to dig into what do we really mean by less cost to society, and what are some of the emerging solutions that we are focused on right now to save patients money and ultimately reduce the burden of disease and the cost of the burden of disease that society embraces, and how as an organization we're really prioritizing that. But more patient benefit, quite simply, could very simply mean more medicines for patients for serious and life-threatening illnesses. We are actively researching in many of the disease areas, chronic conditions, immunological conditions. Oncology is where our organization has had a long history of leadership. And so as we continue to pour investments into research and development, we want to make sure that all patients have access to the best that healthcare has to offer. Oftentimes that's explored within the clinical research setting, and we'll talk a little bit more about that. But that is ultimately helping us as an organization bring and deliver more transformational medicines that help improve outcomes in serious diseases that people experience. So we're really excited about that and that ambition to provide more patient benefit. But we also have to realize that, the cost of healthcare in this country can be expensive, and we need to create solutions and do what we can to ensure that we are reducing that burden of expense that patients can experience. So we really are also focused on providing less cost to society. It's overarching cost of care, and that's oftentimes borne by patients and caregivers. We acknowledge that, and we're going to talk about what we're doing to reduce that burden that both patients, caregivers, members of families, many of you in this audience may experience, when dealing with the cost of your care. So that's going to be the focal point. Hopefully by the end of this discussion, you walk away with a few tips and tidbits on how you can advocate for yourself, how you can empower yourself so that you can have meaningful conversations with your physician. I'm sure the the conversations throughout the day have given you and planted seeds in your mind on questions to ask, things to follow up with your doctors. So we're really excited to draw into focus now some of the cost considerations and how you can ask questions to get access to solutions that are out there to help reduce those costs. So with that being said, we have two experts in this field who have a tremendous wealth of experience, both in the research and development side of our organization, as well as in the access side of our organization, ensuring that all patients have access to the medications that we promote in the market. So for a quick introduction, Vijaya mentioned that we have Rebecca Monroe. She currently leads policy and health equity within our Genentech Patient Foundation. Welcome, Rebecca, to the panel. How about you introduce yourself and just say hello?
Thanks, everyone. Rebecca Monroe, as Gerren mentioned, I'm the policy and governance lead for the Genentech Patient Foundation.
Brilliant. And we also have Meghan McKenzie. Meghan is a strategist within our Chief Diversity Office, focusing on inclusion in our advancing inclusive research and health equity programs. Welcome to the panel, Meg. And I would ask that you say hi to the audience and provide a brief introduction.
Thank you. Thank you. It's always an honor to be in the same room as Gerren and Rebecca, really big health equity champions. I'm learning every day from them. And I really learn a lot from the patients that we talk to. They provide a lot of insights to us in the Chief Diversity Office. So my honor to be here today to talk about the work in clinical research. And Gerren, is part of my primary responsibility in the Chief Diversity Office. And I've been working for over 20 years. I hate to say that, 25 years in clinical development. That means I'm 35, right? I've been working a long time, and I started with patients, and I like to ensure patients know they have options. And among those options might be access to trials where you can get key clinical trial experts who can give you options and help you understand better your disease. And what we want to make sure is that it's never a financial burden, and that if you do have burdens that are financial, that we do not add to them. We don't cost you. So just to understand what the options are. And one primary important thing to us is to make sure all patients in our trials mirror the patients who have the disease we're trying to help. And that's not the case today. Today, we are missing a lot of our African-American or Black or Latino patients, and they aren't being represented in our trials. And we need to make sure the drugs that we're bringing forward and the efficacy and safety of those drugs are generalizable to all patient populations. So a key part of my role is to make sure we're really reaching all patients and they have an option for the clinical trial. And that's my role in the Chief Diversity Office. Pleasure to be here today.
Thank you, Meg, and thank you, Rebecca, for showing up today and for offering the audience a little insight into your expertise and all the great work that you're leading in the organization. So maybe, Meg, I'll pick up on something that you just alluded to when talking about your work within the Chief Diversity Office. More recently, the Chief Diversity Office actually fielded a survey for patients and providers on health equity, really just to understand the perspective of patients on this topic of health inequity, disparities that exist. And to put that in very simple terms, healthcare disparities mean that there are certain populations that when they are diagnosed with the disease, their chances of a positive outcome are different than other populations. So maybe one group of people are, beating certain diseases, being cured from certain diseases, and others are struggling with the impact of those diseases. And so as a company, we have really brought this into focus, and we are committed to be a leader in championing health equity and providing solutions. And one of the things I think we've learned is that, inequities within the US healthcare system exist, it's deep, and oftentimes medically disenfranchised patients or patients from underserved groups oftentimes have borne the weight of this burden. And when we recently fielded that study, we found that, more than half, 54% of medically disenfranchised patients continue to feel that the system is rigged against them. That's very strong and provocative terms. And overwhelmingly agree that healthcare inequities have worsened over the course of the pandemic. When we surveyed physicians and healthcare providers on this topic, about 50% surveyed believe that the healthcare system acts in the best interest of society, but oftentimes acknowledge that there's a lot of work to be done. And one of these areas that I think we've all are starting to hone in on is this issue of the financial burden of care, whether that's in the research setting or accessing medications that are available commercially. So maybe I'll turn the question to you, Rebecca. If you can give us a little bit of perspective of just your experience in healthcare, the part of the organization that you work on, and how health equity has come to life within Access Solutions, and why you're drawn to this space.
Absolutely. Well, I am thrilled to be here and speaking with this group, and just to be in community with you virtually. For a little bit of background, as you've probably heard many times today, Genentech's goal is to be a leader in advancing health equity. So helping patients who are prescribed Genentech therapy and have financial barriers is part of that. And we want to make sure that a patient who is prescribed a Genentech drug is able to begin therapy, and that cost is not a barrier. And so part of how we strive towards that goal is the Genentech Patient Foundation. We also have other parts of Genentech that can help with access issues for patients who have insurance. But I'm specifically part of the Genentech Patient Foundation, which is an organization that gives free Genentech drugs to eligible patients based on income and other criteria. So to me, health equity means in part, can you get the medicine your doctor prescribed? And if not, and it's because of cost, which can happen even when a patient does have insurance, what can be done? Do you know about alternative resources? And can you access the resources available when that happens? So the Genentech Patient Foundation serves uninsured as well as insured patients who are not able to afford their Genentech treatments. And there's a lot of information that you can take a look at on our website, genentechpatientfoundation.com, around the criteria and the different therapies. But essentially, part of health equity is knowledge. And if people don't know about a free drug program, it's not going to benefit them. So sharing about our program with you today is part of how we are engaging with communities directly, bringing our internal teams together and thinking about what more we can do in support of health equity.
I think you really touched on something that's very important, Rebecca, and that is awareness. If you're aware that there are solutions out there, there are people that are working to try to, improve the financial outlook that patients experience when they're encountering the healthcare system, they'll feel confident in exploring what those options may be. They'll talk about that with their care teams, and they'll really start to advocate for themselves to try to tap into all the resources that might exist that can help reduce the cost that patients may encounter. So it's really important to just underscore what you just mentioned, that awareness piece is key. And then just kind of that we can all collectively share, whether it's for ourselves or for our loved ones, our parents, caregivers, others, that we are really persistent, when we have these kind of questions around what options are out there. So thank you for highlighting that. Now, Meg, you spent, as you alluded to, you spent some time in this industry, leading clinical trials across a variety of different disease areas, and have a wealth of expertise on what it takes to run a clinical trial, why that's such an important environment, and something that patients need to be aware about. So maybe if you can offer some perspective on your experience as a leader in our clinical research organization. What are some of the financial barriers that patients may experience when, in being involved in that space? And what makes you excited about the opportunity for us to remove some of those barriers and ensure that patients have access to research by tackling some of the financial challenges that may exist?
Thanks, Gerren. This makes me mindful. I want to start with access and then financial burden, because I think you and Rebecca both, we have to know our options, right? We need to be able to seek information, get information, continue to ask experts, physicians, clergy, people you trust. And what's resonating with that is that I interviewed recently a woman at University of Alabama in Birmingham, and she said, arm yourself with information. This is a fight. So whatever condition you have, she had triple negative breast cancer, and she's a survivor 6 years later. She said, arm yourself with information, have a discerning ear, talk to the people you trust, but really trust yourself. If If you feel like you need to push, keep pushing. So that access, I think, is undeniable. It's something folks need support for families as well. Families are amazing advocates. And I would say that around the financial burden as well. It's really hard to navigate when you have a debilitating or life-changing disease and you're suffering. It's really hard to think about those bills. What I have learned from our partners, from our sites, there's this amazing patient navigator at UAB, and they're really heroes. There are folks at sites who will help you navigate how to get access to medications, like to pharmacists who work with Rebecca's group to be able to get free medications if you're under a certain income level, or navigation to local support for lodging near the hospital where you're going, or travel reimbursement. And Gerren, that's a responsibility we have, where we work at Genentech too, is how are we lifting that financial burden? And 10 years ago, if you asked us, would you reimburse for or offer a compensation for a patient's time on a clinical trial, we'd say, no, that's incentivizing. And today we're realizing, wait a minute, the only people that can come into the door of some of these wonderful centers that are doing research can't afford to come to the door, and that's wrong. So our ethics committees are now saying, wait a minute, yes, we should be able to reimburse for time. That is opportunity cost lost, time that patients are spending with families or potential other treatments. So you should start seeing more, like if you have care, because of a trial, if you're at the clinic, you can get reimbursed for childcare expenses, for elder care expenses, for lodging and travel, parking, food. So don't let that barrier stop you. Continue to ask your physician, where do I go for more information? And then where do I go to seek expert counsel? We realize that access is not always close by. It may be further away. So just don't let that financial burden slow you down, and ask for these navigators. They help connect you with social support, with other patients, with patient advocacy. There's so much support. So continue to ask. And I'll stop there, but feel free to ask me some of the other things we're doing.
Yeah. No, I thought that was really interesting. So if I'm a patient, and you're absolutely right. Maybe, I was diagnosed in shock. I started talking to my family about, the situation. Doctors maybe saying like, hey, clinical trials are, a good bet. Say it's a cancer clinical trial. We've seen that, and the data is very clear on this point. If in cancer in particular, if you are diagnosed with that disease, that participation in a clinical trial in general has been shown to improve outcomes. So it's something that I'm going to want to explore and think about. And so now you're saying that as I think about that, I also have to probably realize that maybe I'm going to go to the doctor more often than I was going to the doctor before. Something that's going to come because I have a new diagnosis. So there's, more diagnostic procedures that have to be done, more lab work, just more check-ins and like that. If I'm a part of a clinical trial now, companies like the Genentech or others are now thinking about, what does it mean for a patient to have to go to the doctor more? What does it mean for, me to have to pay the parking, that $5 every time I go visit my, doctor for routine lab work? So you're telling me that companies are now thinking about trying to remove some of the costs that will be associated with those more frequent benefits. Is that what I'm coming to understand?
Yeah, and it's a responsibility, right? We shouldn't be adding cost for any patient. The sites are very thoughtful around this as well. I mean, both trials and clinic, the opportunities to be able to help people who can't afford to get to the clinic. So there's a lot more today than there was 10 years ago, but you have to continue to ask for that help and find that navigator, call access programs, or talk to your pharmacist about getting access to things that you didn't think you had access to because of your insurance. Maybe you're underinsured. So there are definitely better ways today than I think 10 years ago.
Okay.
To be able to get what you need for whatever the right option is for you.
Wonderful. And you mentioned patient navigator. So I'm going to maybe kind of put a pin on that. That's like a hot take. And I want to come back to you on that, Megan. But before I do that, I'm actually going to turn the question over to Rebecca. This concept of patient navigator, it sounds like it's someone whose job it is to just help patients kind of think about all the things that may not be obvious about their care, or maybe obvious about financial support that's associated with their care. And Rebecca, this is something that I think happens quite regularly within the organization that you sit in Access Solution. You have people who are like navigators for you. They advocate on behalf of patients to try to figure out, a patient's insurance situation, figure out what kind of programs exist, figure out how to help reduce the cost of care. It's kind of like part of what Access Solutions is designed to do. How has Access Solutions been thinking about this topic of health equity, or maybe the Patient Foundation? And is there like some project or some kind of example that's, exciting you recently that's, kind of creating an opportunity for learning and for us to advance this space?
Definitely. And yes, Access Solutions has a great team of individuals who in different therapeutic areas can provide certain levels of support. So anyone who's on a Genentech medication should definitely avail themselves of those resources. Specifically within the Patient Foundation, or at Genentech overall, we talk a lot about working to meet patients where they are. To me, a big part of health equity requires thinking of different ways to meet patients where they are and reimagining what that looks like and what patients actually need in different spaces at different times. So at the foundation, we've been doing a lot of that, a lot of listening, but also actioning on the feedback that we're getting. Most recently, we've spoken to several grassroots community organizations serving agricultural counties in Northern and Central California to understand how uninsured and or low-income farm workers are accessing specialty care and affording medication. So we're not assuming that we know, but asking what we should do to ensure patients and providers who need to know about our free drug program do. Is it brochures? Is it coming to an event and setting up a table? Is it updating our materials to make them more accessible to these community members? One organization asked the foundation to speak with some of the volunteer medical providers that assist under-resourced communities and to just explain the logistics of how they would enroll a patient. How would they order this free drug? Really important questions. And we're here to work with communities to answer those questions to make access easier to our free drug program. So we're listening and we're doing. And part of that is, coming here and speaking with this group, sharing what I can offer and, attending some of the wonderful sessions today and taking feedback to my team on how we might do better at, reaching African-American communities as well. So it's an ongoing and iterative process. And I'm really happy to be helping drive it and be a part of it.
I love the precision and the specificity behind your example, Rebecca. You went to a specific local community because oftentimes when you have these big challenges that we oftentimes admire in industry, and health equity and inequity has been one of those big problems that we've admired for some time, in part because it is so big and there's different component parts to it. But I love how within the Patient Foundation, you all took a very specific area and you zeroed in and focused on what was happening in that area. What are the barriers? What are the challenges? What can we learn? And what kind of solutions can we experiment with in that one area? We've heard and we reflect on the fact that healthcare is oftentimes delivered very local. So the experience of the farm workers in Northern and Central California may be different than the patients at University of Alabama, Birmingham that Meg alluded to, which may be very different than the patients that are in the tri-state metro, New York area and in New England and beyond. So I think this idea of local engagement, both with patients, with providers, et cetera, with the entire system that happens in local areas and experimentation in those areas and real investment on the behalf of companies and the people that work within companies is where we start to find the solutions and where the magic starts to happen. So I love that example. I think that's a powerful one. So we have a couple more minutes. Maybe we'll round out our part of the discussion and then take a look at the Q&A and see what the audience may have. So one final question before we tap into the audience feedback is more like a summary kind of reflection from the two of you. And we'll start with you, Meg. What, in your observation of this current moment that we're in right now, where it's really like a health equity awakening, And we have a lot of attention from some of the most well-resourced companies in the world are really focusing on this topic. What inspires you? What have you seen that is inspiring you about this current health equity moment? And what's one thing you would maybe want to leave the audience with as we then transition to the Q&A? What's something that you would want to leave with the audience?
Yeah, thanks, Gerren. What's inspiring? Inspiring is people are waking up. I think many of us have been championing improving diversity in our research and our clinical trials for a long time, but I think the whole world is starting to talk about what do we do about this gross health inequity that we have among patients and communities of color. So I think that focus is going to be realized into some real change. I know change takes time, but I'm very excited that everyone is talking about health equity and what we can do better. That I'm extremely excited about. For patients and families, I think we've said it, but maybe the 3 A's: ask, access, and advocate. So continue to ask. If you feel like you don't have your questions answered, there are a lot of who are your trusted sources? Are they clergy, family, doctors, specialists? Continue to advocate for yourself and ask. Arm yourself with information, because that will give you more options. And those options will lead to access, whether it's medications, talking to your pharmacist, finding these free medication access programs that Rebecca's talking about, to options around trials or other resources that can help you. And then the advocating, I've been so inspired by patients who really just don't stop. They continue to ask and advocate for themselves, and they find ways to get what they need. Not that we shouldn't be a part of helping patients do that. It's just patients have a lot more power than they think. And I'm happy to be a part of any conversation around that and help people find the resources they need. And I don't know if Rebecca's got a final word in there too.
Sure. I'm just really inspired by all the people attending this event, the organizers, the presenters. I think that everyone's commitment to improving access to healthcare resources in our communities is huge. I don't think you can improve health equity without focusing on Black health. It's a huge part of it. And so that's what health equity is to me, is going into communities and making sure people have what they need. So I hope I've been able to share some helpful or maybe inspiring information that you can share with your communities and your family members about different financial options, and just really pleased to have this opportunity.
Wonderful. So Meg and Rebecca, thank you for that perspective. I think we have time for a lightning round. We can pull some questions that have been dropped into the Q&A, but I just wanted to thank you both. And I'm seeing some of the commentary show up in the chat around the themes that you explored, this notion of the empowered patient, and this concept that who are in the industry have known about for a while and known for a long time, shared decision-making. You are a partner, patients are a partner in the medical decisions that are made on their behalf. And one of the things that I think we really want to encourage in a forum like this is for Black and Brown communities to advocate for yourself so that you can tap into the best that healthcare has to offer. And oftentimes I think we are a bit reluctant to push back on our care teams, to ask questions of physicians. There's the white coat syndrome. We've seen these things happen. I've seen it in my own family. And I think one of the things we have to express is that the future of healthcare is incredibly inspiring, and we will start to cure some of these significant diseases, but we have to fight to make sure that we are a part of that environment and we are taking advantage of the innovation that's on the horizon. So something for us to certainly encourage the audience. So a couple of quick questions. We'll do a lightning round in the time we have left. And Meg, Rebecca, just be prepared for me to ping pong a question to you and just short, quick responses. Isn't there a conflict of interest in Genentech sponsoring this seminar? Genentech is a part of Big Pharma too. Yes, we are a big company in this space. I would not say that this is a conflict of interest, though. I think we have to be a part of the solution, and we have the capabilities, we have the resources to really drive some change here in this space. And we have platforms, and we try to create the platforms to really focus in on the problems that exist and try to drive some real solutions. So I think it would be a conflict of interest if we were not involved in trying to address this issue. So we're going to be a part of it, and that's a commitment that we're making as an organization to continue to be in these spaces. How do we help more people of color get involved in trials? Meg, let's throw this over to you. Studies or advisory committees? Quick reflections there.
If you're interested, we do have a patient co-creation council. We're still trying to improve our numbers on and get patient insights, but patient advocacy. So definitely get involved with patient, or even just find out who the patient advocates are. If it's a condition in MS, there's MS patient advocacy organizations. If it's in oncology, there's breast cancer or lung cancer or liver cancer advocacy organizations. It is definitely a way to bring in your voice, and there's a lot of power with patient advocacy. As far as reach in trials, if your physician or nurse don't understand or know where to go for clinical trials, you continue to ask who is the expert in your local area. And I can give some hints. I'll put it in the chat on where to find doctors. And I see the other is blackdoctors.org, where to find Black physicians and nurses and staff that you may want to find their specializations. But I would say patient advocacy, Gerren, is probably the first go-to for patients to understand what their options are, whether it's trials or whether it's medications or support services and programs.
Wonderful. Okay. And just in the interest of time, I think we were going to have to put a pin on the conversation now. There is a couple of questions around what is white coat syndrome. So just in brief, I will say it is what patients might experience when you go to the doctor's office and you see white coats around, and you know that doctors have gone to school for a long time. So it's a bit of an intimidation that has been clinically studied, where if some patients, their blood pressure may get a little bit higher because of the environment that they're in. They may struggle to kind of think about all the symptoms and their medical history so that they can relay that properly to the doctor. You may be intimidated by a physician because of their education and their training, or perceptions around their education and training. So some of those things are what are tied into white coat syndrome. And that's something that I think is appreciated in the medical community, but something that I think we should start to push through. So we can draw this conversation to a close. Thank you for your attention. Thank you to Black Health Matters for the forum and creating these spaces where we can have these real conversations and start to get to the root of issues that are impacting our industry, but where there's some real opportunity and some real solutions that are exciting, that we all need to be aware of and ultimately all need to tap into, so that we can make sure that we are creating the conditions that we can have the best health that we can possibly have. So thank you to all for your attention. Thank you for showing up at this entire summit. And I want to thank the organizers at Black Health Matters for creating this space. And a special thank you to Vigia Jackson for her leadership in bringing this to the New York metro area. So with that, I will turn it back over to Black Health Matters. Thank you all.